What up, what's happening? As I may have mentioned before, I was born and raised here in the Netherlands, but my father comes from Pakistan. What I usually notice whenever I visit my family there is that they have such different life perspectives and different ways that they look at things. And since I'm a medical student, I usually notice that they have a very different approach to dealing with health problems. This could either be their physical health, but also their mental health. There are a lot of children in Pakistan with a psychiatric disorder, but it's so hard to get them an appropriate and successful treatment. There are a lot of reasons why this never really works out that well, because there are a lot of barriers to overcome that get in the way of seeking help. Usually this discussion is between the doctor and the parents, because parents want their whole family consulted and involved before anything is decided, and they don't really understand the psychopathology of what their kid is going through. They could either be scared or angry and assaulted, or they're ashamed. There are a lot of emotions going on whenever their child is being suspected of having a psychological disorder. So, that's a lot of talk. And in the meantime, people never really ask the children themselves how they feel, what they're going through. An article has recently come out that delves into Pakistan's own cultural, religious, and social norms. And by understanding these better, maybe we can find out why people don't use mental health services as much as we do in the West. And most importantly, maybe we can also find out how in the future we could actually engage them more into getting help and adhering to treatment. So in this research that they did, Pakistani adolescents who already been diagnosed with a psychiatric disorder were given an IPQR, which is short for the Ilness Perception Questionnaire Revised, which is some sort of questionnaire that is designed to figure out how people perceive their own disease and their own mental health. So 52 children were included in this research with a mean age of 12 years old, and the majority of them being girls. The majority of them lived in urban areas, and about half of them were part of a nuclear family, which basically means that you only have the parents and the children living in one home without relatives or grandparents or anyone else. 52% of all families had a monthly income of less than 15,000 Pakistani rupees. That's less than $150 and less than 130 euros. Look, I've never lived in Pakistan, and whenever I'm there, I never really had to handle money because I'm spoiled as hell, but it doesn't really sound like these people are rolling in the dough making it rain every other day. Almost half of these 52 kids had an education up until 7th grade. There was a family history of psychiatric illnesses in 21%, and 50% of the kids have been admitted to the hospital because of their disease. On average, the children suffered around 14.4 months because of their illness. 56 of them had a conversion disorder with depression and/or anxiety. Conversion is a neurological and psychiatric diagnosis wherein you're dealing with so much psychological problems and stress that you're not dealing with properly. Because of the psychological stress that your body is dealing with, it literally shuts down. It's completely neurological. You can get paralyzed, you can get pain, you can't see, you can't talk. Anything can happen, and people will honestly think that your brain is breaking down. So yeah, you won't be cracking jokes with that going on. Other diagnoses that the kids had were major depression, schizophrenia, bipolar affective disorder, OCD, generalized anxiety disorder, and conduct disorder. Basically, most of the adolescents said that they experienced their mental illness as something that's chronic, but something that also gets worse and better in cycles. They felt they had some personal control over their disease and were actually pretty optimistic about getting a treatment, so that was something that they really believed could help. And they also felt that they generally did understand what was going on with them. Males more often experienced their disease as something chronic and felt a lot of emotions like anger and grief along with it. Parents in a nuclear family had more faith in their child's disease being controlled by treatment than people, who live with other joined or extended family members. And they really showed a different response compared to adolescents in the West. They knew a lot less about the nature, treatment, and prognosis of the psychiatric illness, and they thought what they were going through was a lot more chronic and had a lot, worse consequences. So maybe it doesn't come as a surprise that they were a lot more emotional about it and also less optimistic that a treatment would actually be helpful. The reason why Pakistani adolescents are a lot more pessimistic about their psychiatric disorder could have many reasons. I mean, there's definitely a cultural difference where people don't really know about mental services which are available to them and to their family. They have limited knowledge about what's going on with them, and I can imagine a lot of weird myths going around about why you should not treat the problem the way that, most mental health professionals would advise you. Because family members could have negative response to the disease or negative expectation of the treatment. And there are so many stigmas and shame in some Asian countries about mental illnesses that it's very hard to seek help in public. Which basically means that a lot of Pakistani adolescents suffer from mental problems because they're too reluctant to seek help. and therefore end up not getting any. And apparently the article also said that a lot of them added bad luck into the equation. I don't know if that's a Pakistani thing. A lot of research has often observed, not only in Pakistan but also in other Asian, also Hispanic countries, that the people there interpret their symptoms as part of God's will. And it's not only about them being Pakistani either, because even in other countries it is reported that adolescents don't really fully understand the cause, the treatment, the cure of their disease. Puts a lot of weird posts on Tumblr in perspective, I guess. But honestly, I hate to think about all these young people going through that feeling of, you know, I'll just wait for the depression to go away, or if I just try to think and act like normal, hopefully I'll be normal one day. Because this is self-labeling and stigmatizing, which is the saddest thing in the world, because these kids, they deserve so much better. You don't get treatment because you don't think you need it, but a lot of pain and suffering, confusion and loneliness could actually be prevented if you only would just get help. And of course the world is bigger than doctors and psychologists. You know, you have family, friends, religious scholars, faith healers, like those are all possibilities, but medicine could also be one of them. And especially you boys, because male adolescents were a lot more pessimistic about the outcome of their disease, probably because they were also experiencing a lot more shame and stigmatizing. Because girls can be sad sometimes, heaven knows how emotional and irrational they get, but boys, no. Boys should become men, and men are always strong and never cry. But you know what? That's bullshit. Boys cry, girls cry, everyone can suffer. And people care about you. I care about you, and please do everything that you can to get better. Alright, sentimentalism off, professionalism on. So I got all this information about just one article, and it did have its limitations, so I really think that in the future we should have a lot more research concerning countries where mental health isn't really seen that often. And I think in countries like these, we should try to find effective ways to inform people about psychiatric diseases and how to treat them, but also how to help them understand themselves better. You know, make programs for youth, and not only to treat them, but to inform them, inform their family, inform their classes, for example. Because people should be schooled on these kind of diseases, because you can't help your loved ones suffering with a mental disease if you don't understand it either.